Hello and welcome, my dear friends. So, today we are going to have another guideline for review, and this is the Irish guideline for fertility investigations and management in the secondary care. This guideline is mainly discussing the referral pathway and the need for the IVF and when to start the treatment. Please notice the time of the referral, when to investigate or refer. For a woman below 36 years in age, she will have her referral after trying to conceive for 12 months or 12 cycles of unprotected sexual intercourse. From 36 and above, after 6 months, need to be seen by her GP and start on investigation. For cases who have known cause of infertility, like a patient who have already a problem with PCOS or diagnosed with other medical problems, then earlier referral will be considered. For the initial assessment, it will be very important to see the couple both together, take history, assess risk, and discuss lifestyle optimizations. And can make a question in your exam, like, for example, when he gives you a woman have a BMI of 36 and ask you, he tell you everything about her and ask you what would be the advised next step. So in this case, you will advise weight loss and optimization of weight is very important. Also, other problems that could be like smoking or alcohol, couples need to work on. What else will need to check for the investigations? And will start, as I told you, at the GP level. Will be the semen analysis. Afterwards, it will be for the mother, or sorry, for the female, it will be no routine confirmation if the cycle is regular. However, if the confirmation of ovulation is needed, we will advise the mid-luteal progesterone. And please don't say day 21 progesterone, because this is wrong. If a woman have regular cycle but comes every 35 days, then her mid-luteal progesterone will be at the 28, not 21. So be careful. It's mid-luteal progesterone. Urinary LH kits can be used or transvaginal ultrasound to confirm the ovulation. If you are worried about the ovarian reserve of a woman, then the antral follicle count and or the AMH testing. Pelvic ultrasound, this need to be done for assessment in the first 10 days of cycle with a high accuracy transducer. For the tubal patency testing, if there is low risk of tubal problems, then the histosalpingogram or the high COSY, if the pelvic pathology is not suspected. TSH testing will be reasonable for cases who have infertility or suffer from fertility problems. So this is the core recommendation of the RCPI. And how about the semen analysis? Semen analysis, please remember our values is at least volume 1.4, normal sperm concentration at least 15 million per ml, normal or total motility at least 42%, normal progressive motility at least 30%, normal morphology at 4%, and repeat semen sample after 3 months, but you can repeat earlier if there is severe oligospermia or azoospermia. Severe oligospermia, will be recognized if it is less than 5. How about cases with PCOS and anovulation? The cases of the PCOS or anovulation due to WHO group 2, they will have problem with the ovulation, right? So we need to have ovulation induction. What is the best choice for ovulation induction according to the RCPI? This is the letrozole. The letrozole will be considered as the first line. So track at least 2 oral ovulation induction cycles with ultrasound. If no ovulation despite initial therapy, then consider the gonadotropin with or without ovarian drilling. Refractory anovulatory PCOS may require assisted reproduction. So the next step will be either, if no ovulation, I can go for gonadotropin injection plus or minus ovarian drilling. Refractory anovulatory PCOS, remember, assisted reproductive technique. You can cancel for follicular over response and or OHSS and advise protected intercourse until the next cycle. How about unexplained infertility? Unexplained infertility, my dear friends, we will advise IUI. So we don't advise directly IVF. We don't advise only ovulation induction if the woman already have no problem with the ovulation, but it will be IUI with ovarian stimulation. This is the first line of unexplained infertility, and this is a very famous question in the MRCBI. Okay, IUI with ovarian stimulation. Natural cycle IUI is not significantly better than expectant management, so we don't advise the natural cycle IUI. Over IUI for unexplained infertility, also psychological disorder, cervical factor, and donor sperm treatment when the criteria are met. Also in heterozygous, okay, couple, and for people who have, like problem with the intercourse, such as impotence or like dysfunction. IUI should only be considered in stimulated cycles again. All IUI cycle need ultrasound tracking. All IUI cycle. You have to schedule the IUI around 24 hours after positive urinary LH or from 0 to 36 hours after ovulation trigger. Tertiary referral, this is for cases with very low ovarian reserve at the age of 36 or older, unexplained infertility, failed to respond to IUI, or donor gametes or fertility preservation options such as cryopreservation and severe male factor. So please remember those points for the exam, right, for the RCPI, and be ready to solve our mock test. Here we go. So my friends, it's question time, and let's see together. First question is here. A couple attended their first appointment because they have been trying to conceive for several months. They have not had any previous assessment. What is the most appropriate first step in care organization? So that's, of course, it will be initial review in primary care by the GP. Well done. The second question that we have today is 32-year-old woman and her partner have been trying to conceive for 6 months and they have regular cycle and no known medical condition. When should infertility investigation be done? So, of course, this will be after 6 months if the couple is less than 36. If the question was here, they are trying to conceive for 12 months, then what should be the answer? The answer, if this is after 12 months, they will do it now, right? So, very important, my dear friends, that you should know what is the rule. Less than 36, woman age, than 12 months before referral. If this is 76 or above, then it will be 6 months referral. Well done. Our next question, my dear friends, is here. 37-year-old woman has been trying to conceive for 6 months. There is no cause of infertility. What is the most appropriate referral advice? So trying to conceive for 6 months is what you will advise now. Of course, you will consider referral, right? Yes, well done. We will keep on some questions selected from the guideline, and those are easy questions asking a woman with anovulatory PCOS. She is scheduled for ovulation induction. Which oral agent is recommended as first line? And here, of course, the answer is letrozole. Next question is a woman with anovulatory PCOS does not ovulate despite initial oral therapy. What may be considered the next? So next in this case is going to be the gonadotropin with or without laparoscopic ovarian drilling. Well done. And another question about complication of ovulation of induction. A woman undergoing ovulation induction has ultrasound evidence of follicular over-response. Which advice is recommended? Of course, this will be cancelled and give a strict instruction regarding protected sexual intercourse until the next cycle. Couple with unexplained infertility considering treatment, according to the guideline, which IUI approach should be used? Of course, unexplained infertility equal IUI with stimulated cycle. So answer here is B. Well done, my dear friends. So follow our group for more questions and for the final revision, preparing, my dear friends, for MRCPI written exam. You will find us with you day by day, steps and tricks of the EMR CPI. Thank you very much.